When I was a young surgeon, I went to a mentor who was a fantastic person and a fantastic surgeon that I truly respected. And I asked him what was his secret. And he looked at me in the eye and said something that I would never expect. He said it was love. He said, with the difference that so many doctors fail to realize is that the way we get from good to great is to love our patients. Because when you love your patients, you treat them differently. You operate on them differently. You approach them differently. It's scary to love your patients. Because when you love your patients, you also hurt with them. You feel with them. It makes it uncomfortable sometimes, but it truly makes it better all the time.
I'll go back to my own childhood, and growing up, I was always told that I was a sensitive boy, which really bothered me that I was classified as such. One of the perceived weaknesses as a boy was really a strength as a surgeon, because if you have sensitivity, it means that you can sense or detect things that might be subtle, that maybe not everybody else could detect. Surgically in the operating room, the little warning signs and being able to be proactive and see a problem coming before actually encountering it, but also being sensitive to the patient and seeing where they're coming from and meeting them where they are. And so I agree with Sean in that it makes you vulnerable to feeling their pain and struggling them and spending more time and attention, and when they hurt, you hurt. But I think that the highs are much higher and the satisfaction and fulfillment is much greater. It's just like your own having children. When they suffer, there is no worse pain, but also the joy is no greater. And so I feel the same way. And I also think to my own pediatrician growing up, he was a old school Norman Rockwell painting of a physician, and he was always jogging in the morning in the community. He was so capable, so calm, confident, and just, he loved us. And I felt he had a personal connection to me. I think it's very important, as I know you do as well, Sean, that when you're meeting a patient for the first time, to really get to know them, to look forward to seeing them, so they look forward to seeing you, and knowing that even if there's an issue, that you're going to be there for them, that you're going to take care of them all the way to the end.